Hey there, I'm just making it back to the clinic from the operating room, and I had an interesting case today. It was a patient of mine from Corpus Christi, so down south in Texas, who he had done a hairline lowering like months ago, and he had something called traction alopecia. So he had very big dreadlocks that it took him 15 years to grow. And those dreadlocks were so heavy that they were putting tension on the hair follicles, leading some of them to die off or go dormant. And so after his first hairline lowering with another surgeon, they didn't get him to cut his dreadlocks. They didn't use the same technique as I do. They actually did it under local anesthesia, which tells me they didn't really elevate things as much as I do or do relaxing incisions. He had an endotine placed here to take tension off, which was bothering him a lot. And the ultimate reason why he came into me was that his hairline was very asymmetric. So because there was more tension on one side, the middle part of his hairline was kind of pulled over to the side. So what he wanted from me was to even out his hairline, make it look more natural. The incision didn't heal very well either. And so what I did, I brought him under general anesthesia at the surgery center. I was able to elevate the scalp a little more and do what's called intraoperative tissue expansion with galeotomies that release the tension off the deeper layers of the scalp. That takes tension off the incision, helps it heal much better, and I'm able to advance the hairline a lot more. And so I was able to even out his hairline. It looks great. He didn't want me to use his photos, unfortunately, but at some point I think he will, once he's fully healed, want to show off his new look. But the nice thing is he finally was convinced to cut his dreadlocks. I said, that's going to help your incision heal a lot better, help me actually do the surgery a lot better, as well as prevent the hair from continuing to recede, exposing the incision. So because the dreadlocks have been in so long, he had to basically cut them at the base. So he basically got a buzz cut the day before surgery. But I think he'll be ultimately very happy with his decision, and I can't wait to be able to show you his results at some point.